Lots of seats in the front over here in this area. Come on down. Over here. Come on. Hey, Catherine. All right, I'm going to start. Hi, everyone. Good morning. It's nice to see so many familiar faces. I'm Toby Burko. I'm the executive director. I'm losing my voice a little bit, so I apologize if I start talking and nothing is coming out of my mouth. But you're going to see a lot of me today. I'm going to be your mistress of ceremonies, per se. Thank you so much for taking the time to come today to our latest on Lupus patient conference. This is one of our most vital things that we do, and I'm going to take a few minutes today to talk about what we've been up to and what our missions and goals are so that you, the patients, and your loved ones also know how we can help you and how we're here for you. Today's program, which is being hosted from UCLA, thank you, UCLA, for giving us this space, is called Motion is Your Lotion, How Movement Helps You Feel Better. And I know that a lot of you, I would expect a lot of groaning at that point, because I know that lupus patients don't always feel good enough to move your body, but today I hope that we're able to show you some ways in order to do that. And truthfully, I hate exercising, so I completely understand. But we have this great array of speakers for you also. We have an orthopedic surgeon, physical therapist, yoga therapist, rheumatologist, and professional healthcare advocates to come and speak with you today. I think I know that many of you know that Lupus LA was created to find the causes of and a cure for lupus while serving those with lupus and their families in greater Los Angeles and throughout Southern California. For those of you that are new today, welcome. I always love seeing new people, and I know that there are a number of you. For the returning people, welcome too. Since our inception in 2000, Lupus LA has raised over $10 million, and we have three main areas of focus. Our first focus is medical research. We've raised over $1.5 million to fund novel medical research and to fund local rheumatology fellows at our local hospital partners. I'm pleased to share that our latest Lupus LA fellow is named Dr. Julie Kramer. She is a pediatric rheumatologist, and this partnership is with Children's Hospital Los Angeles. She just started. She's amazing. The patients love her. She's doing incredible things. Our previous fellow just ended her 2-year fellowship at Cedars-Sinai Medical Center, she focused both on research and patient care. And she just went on to become a junior faculty member at Loma Linda Hospital and is about to open lupus clinics in that area, which is a much underserved area. So if you live near Loma Linda, great news. You have a great doctor, great resources. And if you want to know more, find me during one of the breaks. Our second commitment and focus is to patient services. We do some amazing things with not a really big staff. Most of you have talked to Catherine McMahon, who's our program manager. Catherine oversees all of our patient services programs, and she'll be up a little bit later. But we have a number of resources for you, and I just wanted to go over some of them so that you're fully aware of the range of services we provide. First, we provide these patient conferences, which I know you know about because you're sitting in front of me. So well done. The second thing that we offer is one-on-one consultations, either in person or on the phone. Catherine is the person who you'd meet with primarily, although we have other specialists that we work with. Catherine can meet with you for a lot of different things. One-on-one for complicated issues such as healthcare navigation, doctor referrals, and also newly diagnosed patients. We have amazing resources for newly diagnosed patients. Do we have any newly diagnosed patients that want to raise their hand? I'm so happy you found us. If you haven't gotten our newly diagnosed patient guide, make sure you talk to Catherine on your way out. And it's also actually on our brand new website that we launched, so you can also get it there. We're also some of our website is in Spanish currently. We're working on making it more bilingual so that I don't think every page, but most of our pages will also be in Spanish and English, hopefully by the end of 2016. We currently have 8 adult support groups. How many of you go to one of our support groups? That's wonderful, thank you. We're about to start a 9th support group for adults. I'm so happy for this. It's going to be held at the West Angeles Church on Crenshaw. We're very excited about this new partnership and this new group of people who are going to come into the Lupus LA family. We also have our pediatric support group program. I think we might have 1 or 2 people here today through that program as well. It's a program that specializes in meeting the needs of pediatrics, both younger kids, and we have a teenager program and their families. Groups are done in Spanish and English and based on age group or parent, and also there's a group for the siblings. So if you know of a pediatric under 18 who has lupus, that's an amazing resource for them. Excuse me. In addition, Lupus LA is the only organization in California that offers emergency grant assistance to people with lupus to help with costs such as medical expenses, doctor copays, we do utility bills, sun-sensitive clothing. If it's related to your lupus and you fill out the application, it's great. It's up to $500 a year, once a year, and you can reapply every year. In 2015 alone, we've given 24 lupus emergency grants. We call them LEGs. That's over $11,000 in grants that we've given out. And we look forward to helping more in need. So if that's something that you're in need of, give us a call. Our last focus is promoting awareness. We do this through our advocacy work, both on a local and national government level. We lobby in Washington. We talk with representatives in California often to bring about better health care and increased government involvement for lupus patients. Lupus LA also launched a new blog this year. How many of you are aware of that? I should see everyone's hand in this room go up. So when you go home today, log on to lupusla.org and sign up for our blog. It's called Into the Loop. And every week we have posts about a variety of different things, from dealing with the sun to lupus and nutrition to lupus and exercise to other sorts of resources. We have guest bloggers, we have doctors, therapists, lupus patients. It's an amazing thing. It's brand new. It's interactive. You can leave notes. We're also going to be launching a video blog this year where members of our medical advisory board will be answering questions that you, the patients, are proposing. It's called Ask an Expert. Look for it. It's not ready yet. It'll be soon. Lastly, we continue to spread outreach through our Celebrity Ambassadors program. We have added 3 new ambassadors this year. Our list is constantly growing. Taylor Spritler from the Disney Channel. No, she's from she was from the Disney Channel. Now she's on a Melissa Joan Hart show. Mekhi Phifer, and we just added, like a few weeks ago, Seal. Very exciting. And there are some more in the works, which I cannot share. But I look forward to sharing at the next one. So listen, we couldn't meet all of our goals without you, our patients, our donors, and our corporate sponsors. And I want to just take a moment also to acknowledge from the podium Erica Mangum. Yay, hi. Thank you for coming. Erica is from the Alliance for Lupus Research. The ALR is a wonderful organization helping take lupus medical research to the next level, along with our current partner, the Lupus Research Institute, who I know you've heard about. There's information about both of them in your folders, so I encourage you to look at them. They are the two leading organizations in this country that are giving medical research grants out. They are both intimately involved in the clinical trial process. We're going to hear more about that later today. So I really think you should look them up. And Eric is here to answer questions during breaks, and I'm around for the LRI. But lastly, we could not do these conferences without our corporate sponsorships helping to fund them. GlaxoSmithKline, GSK, and UCB, yay for both of them. They didn't send representative this year, but I will let them know you clapped. And also Pharma, who we will have a representative from later. Pharma is a really interesting organization. They're actually the lobbying group for the pharmaceutical company, and one of our patient advocate specialists, advocacy specialists later, works for a company that runs a lot of pharma's programs. Before we move on to our first presentation, welcome. There are more seats in the front. Come on down. Don't be shy. A few housekeeping notes. In your folders, first of all, how many of you is this your is this your first patient conference? Wow, that's amazing. And how many of you also go to our Orange County conference? That's great. So again, we run 2 conferences a year, one up here in LA. We sort of flip-flop between here and some other venues, and another one down at UC Irvine. So that's in the spring. And they're always different, so I encourage you to go to both. So for those of you who have not been to one of these before, in your packets are index cards. They're probably very brightly colored. The way this works is after each presentation, we're going to try to have a little bit of Q&A. If you have a question, please write it down. And then there'll be staffers in the aisles. I think it's actually going to be Ruth and Sylvia, but they're outside. Oh, Sylvia's back there. To collect them, and they'll bring them up. We will not have time to answer all of your questions. I can guarantee it, because I know you all have a lot of questions. However, what we do is after each conference, we take the questions that weren't answered, we ask our specialists to answer them, and we'll disseminate the information via email within the next few weeks. So don't be shy. Ask your questions. They're all important. They're all good questions. So I encourage you to do that. All right. I'm going to start a little ahead of time because we always run over, which is pretty amazing. Our first panel discussion is going to focus on movement and your joints. Each presenter will give a brief talk, and then when all three have done their spiel, I'll come back up and we'll do some Q&A. Our first presenter is Dr. Jason Snibbe. Hi. Dr. Snibbe is a board-certified orthopedic surgeon focusing on sports medicine and joint replacement surgery. His practice has a special focus on hip preservation techniques and reconstructive surgery. He's worked on lupus patients. He's actually worked on Lupus LA staffers. So all of us. Dr. Snibbe is also an active member of the Lupus LA Medical Board. Anything else you'd like me to add? Great. Please welcome Dr. Jason Snibbe.
Well, thanks for having me. I really want to thank all the people on the Lupus LA staff and all the people that contribute to Lupus LA. I was asked, because of my relationship with a lot of patients, to be a part of the Lupus LA organization. It's really an honor to be a member of the Medical Advisory Board, and it's really taught me a lot about lupus that I didn't know, because of my field is more related to the surgical side of things, less on the biology and less on the kind of the more specific scientific treatments for lupus. I'm going to talk to you kind of casually about what joint health is, the way kind of an orthopedic surgeon thinks about it, and also just try to educate you about what is a joint and what does it mean to have a joint problem, what does it mean to have issues in your joint. For most of you, the joint is a part of your body. Let's say we'll use the hip as an example. The hip is like a ball and socket. And there's several parts to that ball and socket that are important, and there's parts that when they break down makes a big difference in your life, the way you move, the way you walk across a room. The main part of the joint is what they call the articular cartilage. That's the cartilage that covers the bone, okay? The cartilage that covers the socket, covers the ball. When you think about articular cartilage, you think about, when you're driving down the street and you see a building and they have scaffolding in the front of the building because they're painting the building. The scaffolding is the matrix, and there's this matrix that attaches to the bone. So imagine that scaffolding that's attached to the bone comes up. The little workers that are on that scaffolding, those are the cartilage cells. So there's two important parts of a joint. There's the matrix, which is this thing that attaches to the bone that allows the cartilage to be attached to the bone. And why are those two things important? They're important because we're learning a lot of information about the biology of why these things break down. People with lupus obviously have an autoimmune disease where the body attacks those parts of the body. But we're learning that there's certain hormones that attach to the matrix, certain hormones that attach to the cartilage cells that break down the joint. And that's a very important thing that we've recently discovered about the biology over the last maybe 10 years. As you know, around that joint, there's ligaments, and the ligaments are what attach the bone to the bone. So in the hip, there's ligaments in the front, in the back, and the side. And there's also parts of the joint that are more kind of like almost like bumpers or almost like seals. So in the hip, there's a seal, like a ring around the socket called the labrum, and that provides a suction seal. And the analogy I use is like, when you go buy those things from the market where you stick it to the glass. There's that negative pressure, and it's hard to take that suction off the glass. That's the way your hip is. And if you pull on somebody's hip, trying to separate it, if you put a needle into the hip and let that negative pressure release, you can pull somebody's hip out a little bit when they're asleep, obviously. So there's this, or if they owe you money, So if you allow that negative pressure to release, we're learning a lot about that negative pressure, and we're learning that negative pressure is actually probably beneficial to the cartilage. And when you lose that negative pressure, for example, you tear the labrum, you injure the labrum or that suction seal around the hip, that's when the hip starts breaking down. That's when damage happens. That's when the cartilage starts breaking down. And then lastly, there's tendons and muscles all around the joint, which are very important to basically maintain that joint and keep that joint moving and strong. And really, when you think about the muscles around a joint, you think of them as like a shock absorber. If you drive down the street with a car and the shock absorbers are dead, you're going to end up destroying your car. You're destroying the chassis of your car. Also, when you lose muscle, you start having pain. So people that come to us sometimes, that let's say have had a muscular injury, like they have a back injury and they lost the muscle control to their hip, they'll say, my hip hurts. And you take an x-ray and nothing's wrong. You take an MRI, nothing's wrong. It's a muscular problem. So, and Karen Jobert today, who's our physical therapist on the panel, will talk a lot about muscle building and muscle control, but the muscles are very, very important. So when I look at a patient, we think about your joint, we think about all these different things that contribute to the joint. One of the things we're doing lately in our field is, the surgery that we do is amazing. We do a lot of great things, and we'll get to that in a second. But the biology of that matrix and the cartilage has become a huge arm of our work. One of the most interesting things that we've done and working on right now is the use of amniotic fluid, which I think is a really interesting thing. So that matrix that I told you that attaches the cells to the bone is made of a special substance. It's the same substance that the amniotic sac of a woman is made out of, which is interesting. So why does a woman not have a baby at 3 months? Because there's something in that amniotic fluid that prevents the breakdown of that sac. So what we've done, there's a company we've been working with, is that they take women who are about to have a C-section, and they put a needle into the uterus, they draw out all the amniotic fluid, and they freeze it, so they preserve it. So there's an idea that if that fluid prevents the breakdown of that matrix, why don't we put it into a joint? And why don't we put it into a joint and see if it protects that matrix from breaking down? And that's some of the things that is important for you to know as patients and people that are involved with joint problems, is that this is the new level of things that we're talking about. Because there's a lot of people in this world that are in what I call the gray area, that you don't have a normal joint, you don't need your joint replaced, you don't need surgery, but you have some level of joint pain. And there's those people, we don't want to operate on everyone that walks through the door. We want to make sure they keep them away from surgery and keep them healthy and happy. So there's a lot of this biology trying to figure out how this matrix breaks down. And we think that there's receptors. So receptors is like there's a cell and there's little parts where the hormones attach. And we think that amniotic fluid blocks multiple receptors on those cells and on the matrix to prevent the breakdown that could potentially prevent the breakdown of a joint. The only thing that we don't know is how much to give and how often to give and all that stuff. So if you have a shot in your knee of a certain substance, and you say, I feel great, do we do it every year, every 2 years, every 3 years? That's what we're working on. But the important thing about our field in orthopedic surgery is that we're not only working on better operations and better treatments, we're also working on biology, trying to figure out biologically how to make you better. And I think where we're moving towards is a point where you come into the office and you say, okay, we take an MRI of your hip, let's say. And you say, oh, you got a little bit of arthritis, you got a labral tear, you got this, you got that. We'll draw your blood and we'll send it out somewhere to a lab, and they'll treat that blood with different things. We'll give you amniotic fluid. We'll treat your blood to block some receptors. We'll do all these different things to you biologically to try and get your joint better. So just like when you have lupus, they give you something biologically to prevent your body from attacking itself. We're going to do things that can prevent your body from breaking down things early on in your life, and that's very, very important. The other thing that's important to know as a person, and as a person with lupus, is the actual day-to-day health of the joint. So the way cartilage gets blood supply, some of it comes from the bone. So the cartilage layer is here. Some of it comes under from the bone, and some of it actually comes from the joint fluid. And when you have a joint and you move a joint back and forth, what happens is that you're actually squeezing fluid out of the cartilage cells and into the cartilage cells. So it's going, fluid is coming in and coming out, coming in and coming out. And that ebb and flow of fluid through the cartilage cells and through the cartilage is very, very healthy. So for example, if you took somebody and you put them in a cast, you kept their knee straight for 3 months, a lot of times the joint will break down. The joint will get destroyed because that natural ebb and flow of fluid is gone. So as a person with joints, which we all have joints in this room, the natural movement of the joint is important. Okay, it's very important to have gentle movement and to work on the movement of your joint to maintain your range of motion, to maintain your function. Obviously, it's important to keep your muscles strong, and Karen will talk a lot about that, but one of the things that I'll say about that is that we have a trend in our society towards being very aggressive, being very crazy about exercise and crazy about getting out there and walking mile after mile after mile. I think it's important for people to know that there's a limit to that. And right now in America, there's more people having joint replacements under the age of 50 than ever in the history of America. And we're attributing a lot to that because there's people that come into my office that are, let's say, water polo players, and they're 18 years old. They tell me, they say, I only play water polo. I play water polo every day of the year except for 2 weeks when we take a family vacation. And you're like, that's insane. It's so much intensity of sport. And I think that it's important as a society and also as people to make sure that you don't overdo it on your joint, because we don't want the joint to break down. So things like high impact, things where it involves a lot of running or a lot of intense impact is not good. So we prefer walking, elliptical, swimming, biking, things that are low impact to maintain that motion for the ebb and flow, and also to maintain the strength and the power around the joint. I think that and then lastly about surgery. We like to do surgery only if necessary. And as the years have gone by, the people that have lupus, that eventually their joints break down and require joint replacement, that surgery has become so refined and so good. And I'll tell you, this year, there's a huge push in America to talk about doing outpatient joint replacement, where we're doing hip replacements as an outpatient. They have it done, they go home the same day. And we've done about almost 30 this year, I've done. So people are having surgery and going home the same day, which is really an incredible thing to provide to patients. And I think that ultimately, the goal here is that we want the surgeries to be better, we want them to be less invasive, but we don't want you to get the surgery if you can avoid it. So maintaining the strength and also working on some of the biology is becoming a huge arm of this field. And it's something that where you and your community, if you do have joint pain, need to talk to your orthopedic surgeons or your rheumatologist about what are the different things I can do to maintain my joint health. But the first thing is to educate yourself on what is the joint, what's the anatomy, what is in there, so you better understand the movement and then the problems that may arise. And lastly, keeping yourself fit and keeping yourself active is very, very important. But I think it's an exciting time in our field, in orthopedics. It's exciting for you because you get the opportunity to live in this era where so much technology and so much innovation is happening. Thank you.
Dr. Snibby, thank you so much for not going over time. That was amazing. Thank you so much. Not a lot of doctors do that. All right, our second speaker is Karen Joubert. She is I got to get to her on my page. She's a physical therapist and owner of Joubert Physical Therapy in Beverly Hills. Her practice is diverse, ranging from orthopedic injuries to autoimmune pathologies. So that means she works with lupus patients. She has more than 35 years experience, and she understands the needs of her patients from a pain management to a fitness perspective. So please let me welcome Karen Joubert, who's going to talk about lupus flares and injury.
Hi, good morning, and I'd like to thank Lupus LA for asking me to speak today. It's something that I'm very, very passionate about. You can look at my bio for more information, but I've been practicing for over 20 years, and I have an outpatient physical therapy practice. I also practice a lot with Dr. Snibby, and my patient population ranges from young to old, and we see all kinds of orthopedic pathologies, but more recently, I see a lot more cases with autoimmune diseases such as RA and lupus, and it's made a big impact on our practice. So Dr. Snibby raised a few issues that I'm going to touch upon because it's really not about, let's go and exercise. I see a lot of you at different stages of your lupus, crutches, canes, etc. So I think the one point I really wanted to emphasize with all of you is that every one of you comes here unique with your own presentation, and I think that it's important for your healthcare practitioner to acknowledge that none of you are the same. You're all unique with your own presentation, your own complaints, your own fatigue, and so we really need to address that when starting any kind of exercise program. So my goal today is to share some important insight that I've learned over the years, and trust me, I've made a few mistakes with my lupus patients, and you guys have been a great teaching tool to myself, and I hope that this is helpful to you. So even before you start any kind of exercise program, it's really important to address, I like to call it like a 3-tier approach. There's so many important aspects that you have to recognize, especially when entering into a program, and these are things that a good physical therapist should be able to help you with, and especially during trying times of a flare-up. So tier 1 or phase 1 is really important to go through an evaluative process with your physical therapist. And I think the emphasis should really be addressing, your daily activities. How does lupus impact your life? How does it affect, sleeping, dressing, waking, exercise, sports? What is it that it prevents you from doing? This is really important. We usually give our patients in our clinic something called a disability ladder. So this will let you spell out everything, like what I said, dressing, sleeping. What is it that you really have issues with on a daily basis or during a flare-up that you need to have help with? And we always say, too, it's not that you need to give up what gives you joy and happiness, but sometimes you just need to make modifications to your daily activity. And what I've learned through my lupus patients is sometimes this can be as simple as monitoring your breathing. We do a lot of diaphragmatic breathing. That's what we teach our patients, which is so important in the middle of a flare. Or it can be looking at, your energy expenditure on a daily basis, because that can create a flare also. So the second tier, phase 2, during the lupus flare is really important, and is to acknowledge your mood. And we all know that during these lupus flares, you can become extremely depressed. Depression then manifests itself in physical issues. So you really need to acknowledge this. This is important, because how is this going to have an impact on your therapist that wants you to exercise, and participate in a program? So my experience with my lupus patients during a flare is we do quiet time. We teach them diaphragmatic breathing. We go back to the basics: posture, breathing, gentle stretching, maybe even some simple yoga drills that she's going to talk about. Soft tissue massage, just starting to make you feel good again. It's not about, especially during a flare, getting out there and exercise and strengthening. It's really just getting control of yourself again. Currently, we've had really good success in our clinic. I years ago came up with a physical therapy app called My Therapy Exercise. And so what I've done with a lot of my lupus patients is we have a little program, especially because you wanted me to talk about a flare-up, a little program that you can follow when you have a flare-up. So you can go on your iPhone or your iPad or your computer, and depending on who it is, we'll come up with your little program, whether it's, okay, when you have a lupus flare, I want you laying down. You're going to do, a minute of diaphragmatic breathing and some postural drills, whatever it is, or if it's hip exercises, because Dr. Snibby said they needed to do them. But this really, it enables you to take charge of your flare-up instead of, feeling helpless. What is it that I do? And it's really been a great tool to empower my patients with lupus. It's like, okay, I know I've got something that I can do. And you don't feel like you have to run to your healthcare provider and go, oh my God, I can't function, I can't walk. What is it that I do? The third phase, or tier 3, is something that I personally feel like has been overlooked in my experience, especially with the cardiovascular issues that lupus can create. And again, I was talking about this, but the very first thing I'll do with any of my lupus patients in my clinic is I teach them diaphragmatic breathing. And that just gets you in control of your breathing. You probably thought I was going to stand up here and say, okay, here's your exercise, and that is an important part of it. But in order to get to a customized exercise program, you really have to get in control of your breathing, your posture, what moves, what doesn't move, what needs to be strong, what's moving too much, what's moving too little. So again, I'm just trying to emphasize the importance of how unique each and every one of you are. It also, again, once you have these tools, you have a flare-up, some steps that you can take on your own to help you. So it's been my experience that you now are not relying on the healthcare providers, but you're relying on yourself, and it really makes a difference. It's been my experience also that even the slightest of exercise, even though I wasn't talking about the slightest of exercise, any kind of movement will enable you to start feeling better. It'll start allowing you to take charge. And I think Dr. Snibby was talking about, too, how important it is to move. Yet it's kind of a double-edged sword, because we want you to move, yet you're so uncomfortable. It's like, what are these guys crazy? They think I'm going to move. So again, just doing basic like postural drills, range of motion, because as Dr. Snibbe was saying, it is so important to find some way to do movement because it lubricates those joints and keeps them healthy. So if you have someone working with you on a one-on-one plan, it will really help you come up with a program that works for you, not for anyone else. So the issue of exercise, again, is here's where the problem is. It's like, yes, we want you to exercise, but now we have to be mindful of doing too much exercise, which you know can create a flare, or it can also cause overheating. So you have to really be respectful and mindful of that. So your exercise program has to be tailored for your needs, your goals. And this is another tool that we've really had good luck with. I really encourage my lupus patients to invest in either a heart rate monitor or, the Fitbits that they have out now. They're really beneficial in monitoring your heart rate, your energy output, because in my personal experience with lupus, the patients that come into the clinic are usually there because they've pushed themselves too much. And, if you are monitoring, we can teach you how to monitor your heart rate. You'll know that, okay, this is the level. Maybe I can't, like Dr. Snibbe was saying, maybe I just walk 5 minutes twice a day instead of, a half hour or 3 times a day. Also, one last thing I wanted to address with all of us here speaking on a panel, we're here to work for you guys as a team. It's not you see one person or the other. We should all collaborate and help you as a team. It's really, really important in the health and the progression of your program. Like I would work in conjunction with Dr. Snibbe. I would work in conjunction with Dina. And we're here as a team to support you for your wellness. Okay, thank you for allowing me to participate today.
Thank you.
Nice job.
Our next presenter is Dina D'Angelo. I've actually known Dina for a long time, and I'm going to tell you about her, but I wanted to say that she is an incredibly compassionate person, both as a person and also as a practitioner. She's a certified yoga therapist and Ayurvedic wellness coach who's deeply committed to sharing the wisdoms of yoga's power to improve health. And she currently partners with doctors to provide rehab exercises for patients alongside people like physical therapists, and works privately with clients throughout Greater Los Angeles, teaches classes and workshops at various wellness centers. Please welcome Dina D'Angelo.
So I got the yoga casual today. Professional on the top, yoga on the bottom. It's so nice to see so many of you out there. Thank you for sharing your Saturday morning with us. So Toby did a great job of introducing me, and I'm really here to shine the light on what yoga therapy is, because some people might not know what that is. Some people might have been given a recommendation, hey, you should do yoga, but I'm here to say you should do the right type of yoga, not something like in a commercial where somebody's in a pretzel pose. That's not what we want, okay? So some of the benefits of utilizing yoga therapy are they offer multi-level benefits because we can help you with physical, mental, and emotional well-being. Yoga can calm the nerves. It can assist in managing stress. It provides deep relaxation. It can help with fatigue. It can relieve pain. It also aids in developing better quality of sleep. We keep the joints limber. We can ease body stiffness. We can also help the body detox with yoga. We build muscle strength and flexibility, support heart and lung health, and support overall immunity. As I said, it supports mental health, and it can definitely help with depression or anxiety. It also helps you regulate your moods. It develops focus and body awareness. As was mentioned, a lot of postural notes can help you out with things as well. It also helps with balance and coordination, and it can help avoid weight gain you may experience as a side effect of medication. So what is yoga therapy versus just yoga? A certified yoga therapist is trained far beyond the scope of a typical yoga teacher in the field of therapeutic yoga. We have studied the body's anatomy extensively and often collaborate with other Western medical professionals. Along with supporting a client's physical state of strength, joint range of motion, and overall flexibility, we work with the various body systems and disease management. We target lower stress and often support our clients with their emotional and well-being needs. Many of my patients are people dealing with things such as lupus, scoliosis, MS, back and neck issues, arthritis, chronic pain, autoimmune challenges, Parkinson's, ALS, and fibromyalgia. I just wanted you to know that we can reach across all of those diseases and challenges. Yoga can look intimidating based on what you see in the magazines and TV ads. I'm noticing, like I said, that doctors are quick to recommend yoga, but they don't specifically recommend what type. So there are many styles, just like there are shoes. You need to find the right one that fits. So yoga therapy, if you can find a class that's called therapeutic yoga, hopefully look for one of those classes that's actually taught by a certified yoga therapist. They're going to be more gentle. They're going to be mindful of joints. They're going to work with flexibility and supporting all the levels of emotional and mental and physical health. Restorative yoga, if some of you have heard it, and you can go on a website of a yoga studio and look up these names of yoga. Restorative yoga focuses on deep relaxation and supporting the parasympathetic nervous system. It's great for stress management. So we all know probably about fight or flight. That's your sympathetic nervous system. That can be aggravated when you're in a state of stress. We want to take it to the opposite system, which is your state of rest and digest. So restorative yoga would be a good option for that. Also, there's a yoga called Yoga Nidra. It's a guided relaxation that aims to release physical and emotional tension being held in the body. It's offered as a practice in itself, or sometimes it's part of a group class. Meditation, yoga's companion, can support focus, positivity, coping skills, overall calmness, and improved mental function. There are plenty of studies that support meditation as a great tool. And then what I would recommend is if you have not started yoga yet and you want to work with someone like myself, you can come and do a private session, and as you mentioned, we come up with a personalized practice plan. So basically my role is to make things sustainable so that they complement the work by your other practitioners. Another thing to consider as a lupus patient is that you want to figure out what type of yoga to do. So that would be dependent on whether you're in a flare-up or not. If you're in a flare-up, your yoga practice should be restorative with deep relaxation to take you out of the fight or flight that I mentioned into the rest and digest. This is actually good at all times, so it doesn't have to be when you're in a flare-up. We live in a stress-filled world, and we know stress is a major trigger for lupus. Deep relaxation supports peaceful rejuvenation, stress relief, and pain management while accessing that parasympathetic nervous system. If you aren't in a flare-up and you want to utilize yoga for joint mobility and flexibility, as I mentioned, consider a therapeutic yoga class or gentle, or there's also Iyengar style yoga with the right teacher, which is about alignment, which would be great for your joints. So you can get good stretches and alignment-based weight bearing, as well as the other well-being benefits of a yoga practice. Remember that motion is the lotion that keeps our body supple and move with ease. So therapeutic yoga plus lupus, why this equation works. Yoga doesn't embrace a no pain, no gain philosophy. In fact, it's quite the reverse. It's about listening to your body and working with it. Developing this body and mind self-awareness is key, as every day may be different symptomatically, as you all know. What works for one day of alleviation may not on the next. Yoga also incorporates conscious breathing techniques that have profound effects on lowering the heart rate, bringing about a state of peacefulness and easing chronic pain. If you can breathe, you can do yoga. Yoga and meditation are proven to have a hugely positive effect on emotional and mental health. Regular yoga practice often helps a patient start to find an improved ability to relax and handle stressful situations. They can focus their energy and attention more effectively, and they can think more positively. Finding gratitude for life and disease acceptance provide inner peace. Life doesn't need to be centered on the disease, but instead can be lived with a sense of meaning and purpose. Yoga can be tailored for anyone, regardless of their experience or level of well-being. It can adapt according to what is attainable for the patient on any given day. Yoga's benefits address a full spectrum of challenges faced by a lupus patient, as I mentioned in the beginning. Used as a physical exercise, it releases endorphins that can improve mood and reduce pain. Used as a relaxation practice, it can calm the nerves and support immunity. In closing, I firmly believe three things about yoga which are backed up by numerous studies and personal experience. I offer that yoga therapy is an optimal holistic approach as it takes into account the whole individual, their lifestyle, and other modality treatments being utilized by the client. Yoga therapy's aim is personal sustainability. Stress reduction is key to all disease and health issues. So it's always my point of view to get the stress down. And I can teach you breathing. We're going to do some fun things this afternoon, some chair yoga and some breathing that anybody can do anywhere, whether you're a corporate person or you're in a flare-up. It's all good. Yoga can provide us with the life skills to handle just about any situation. Nearly all health issues have a therapeutic yoga prescription to help in treatment, and a knowledgeable yoga therapist has a toolbox of techniques to utilize. I have an abundant network of fellow yoga therapist colleagues to assist with your needs, so please feel free to talk to me. If you're involved in a support group and would like a referral to teach at your meetings or someone to work with you personally, please come leave me your information or let Toby Burko know. And thank you so much for the opportunity to share the benefits of yoga for lupus.
So we're going to open it up to questions. Catherine's on this side getting cards, yes? Sylvia, you're on this side getting cards. Write them on down, pass them on up. Yes. Oh, yeah. I could try. Yes.
There we go.
I do know how to do that. Do we have any cards? Great. I'll take your cards. All right, these are in no particular order. Okay, is it possible to have increased fatigue and increased joint pain with no change in blood work? Can it be called a flare-up without the evidence in blood work? Anyone?
You can answer that?
Yes, there are
I
mics.
think, is this on? Yeah, okay, cool. It's absolutely possible. I mean, there's a lot of things that we have diagnoses for. And like we always say in medicine, there's a lot we don't know and a lot we don't understand. And I think that there's people that the rheumatologist will call seronegative arthropathy, meaning that you go to a rheumatologist, they do your blood, they check your blood, and they find out that, you know what, nothing's positive, but you got a joint that's red hot, you got some, maybe a little strange rash or this or that. So there's people that don't fit into those cookie cutter diagnoses. And there's a lot of people. Actually, one of my best friends has that. He's got like a little bit of psoriasis. He's got kind of a bad knee. And he he probably has some level of psoriatic arthritis, but nothing's positive on the blood work. So there's many levels. You can have a little bit of this, a little bit of that, and but the bottom line is that if you have symptoms, we treat you, and we treat you just like you would be treated if you had rheumatoid arthritis or psoriatic arthritis at different levels. And so I think that just because your blood work isn't positive doesn't mean you don't have a problem.
I also wanted to add to that, Jason, just like I was talking about, everybody is at different stages, and it is not the one thing I've learned in all of my years, especially with my autoimmune patients such as lupus. No two people are the same, and everyone is unique. There is no cut and dry. That's why I was trying to emphasize the fact that it's just you guys are all so individual. It's not like, okay, here's the 10 exercises I want you to do and you aren't feeling good. So I completely agree that, yes, this can happen.
Thank you. Okay, can you explain the differences between Hatha, Vinyasa, Bikram, and what is best for lupus and fibromyalgia?
So Bikram is going to be an environment that's warm, which might feel really good on your joints, but you want to be careful that if you go to that type of environment, you don't get overheated. So in my opinion, from my lineage, it's not something that I would recommend. There's a different version called hot yoga, and often the room is not heated quite as high. So that might be something you want to try. It's not on my favorite list of recommendations, though. Then as far as, what were the other ones? Hatha, flow. So I would not recommend flow yoga until you get your bearings on the foundational pieces and you're feeling good. But certainly if you can find a gentle hatha flow once everything is feeling good in your body and you're not in flare-up, that might be something you want to try. It's always good to go into a class with a lot of information so that you know what's appropriate for your body and what is not going to serve you well. And like I talked about, tuning into your inner wisdom, knowing what's going on in your body, because it's going to be probably different every day. And was there one more? Fibromyalgia?
Yes.
I treat the fibromyalgia in the same way that I treat anything with autoimmune. We just don't want to overdo it. So I'm going to keep you on the list of gentle or therapeutic, and if there's a little bit of flow because you feel all right, go for it. Thank you.
Thanks. This is for Dr. Snibby.
Yeah.
If one hip is okay and the right hip locks, where I cannot raise my leg to stretch, how do I fix this? That's a good question. How do I fix it?
How much time you got?
You got about 2 minutes.
No, I'm just kidding. I think that a lot of what depends on why hips lock or are stiff is based on a lot of different things. And one of the things that I specialize in is a concept called hip preservation. And basically it has to do with the non-arthritic hip. When we're little kids, when we're like, 9, 10 years old, there's a growth plate right below where right below where the ball of the hip is. And we're learning a lot about the way that growth plate fuses is a lot dependent on your genetics and a lot dependent on your athletics and how active you are when you're a kid. And so once the anatomy of your hip changes in a certain way, the ball of your hip is not exactly round. So if you think of like a perfect ball, like a cue ball on a pool table, perfectly round, or basketball or baseball, perfectly round ball, that rotates nicely inside of a socket. But if the ball isn't perfectly round, it doesn't rotate. And there's this point where there's a conflict where the two bones hit each other. If that happens over and over and over again, that in itself, that anatomy can be restrictive in your motion. So that's one reason why you can be stiff. The other reason is that when you have that anatomy, you can injure your labrum, and that labrum can cause catching, clicking, pinching in your hip. And then if that's painful, you'll avoid that range of motion. Your hip will become stiff. And then ultimately, we always worry about arthritis. Is there a little bit of anatomy issue, labral issue, or arthritis? So ultimately, if you have limited range of motion, you should see somebody like me to take an X-ray and evaluate you, do a good exam, and maybe get an MRI to understand, do you have arthritis? That concept I talked about where the hip is not shaped properly is called impingement. There's a long term called FAI, femoral acetabular impingement. It's a long word, you don't have to memorize that, but it's basically, just think about impingement. So do you have impingement? Do you don't have impingement? Do you have a labral tear? Do you not? So there's a lot of different things I think about when I'm approaching a hip patient, but if you do have stiffness and if it is bothering you, there are solutions, surgical and non-surgical.
I wanted to add one thing. I wanted to add one thing to this. The other thing is I have worked a lot with Dr. Snibby's patients, and we have cases like this. One thing I wanted to tell you, and especially with lupus being involved, the worst thing you can do is try to stretch it aggressively. The best thing you can do is some of these cases, because he's really pro-rehab, is just learning how we were talking about, just moving. Gentle moving of the joint will lubricate it, create a little bit of joint space. So I want to emphasize a lot of times when we have even like a stiff neck, the worst thing you can do is start to just crank on it. You want to try to do a lot more movement to get blood flow and lubrication in the joint space. Thank you.
I'm going to actually ask Dr. Swami Venutrupalli to just join this panel. He's our keynote speaker this year. I'm going to talk all about what his credentials are and how awesome he is. But he's going to help answer some of these questions that are a little bit geared, because these are amazing and wonderful questions, and a lot of them. If they're geared more to a rheumatologist, we're just throwing him up here to answer questions now, and he'll answer questions later because we have a little time. Okay, for Karen, I want to run again and hop and skip and jump. I can't read this. Something machine help me do this.
Oh.
Inflated?
Oh, yeah.
Thank you.
I think someone was possibly talking about the Alter G. Is that correct? Who had this question? Yeah, it's so funny. I got this machine about a year ago because a lot of the orthopedic surgeons said I needed it for rehab, and the athletes. And then what I started to find out is people, lupus, RA, whatever, I would put them in this anti-gravity machine, and it would just float you. So if you've got a pretty arthritic hip or whatever, I can have you walk at 50% of your body weight. And the funny thing is, I bought this thinking I would use it for the athletes. And you know who uses it the most? My patients with autoimmune problems. That for the first time, they're walking 15 minutes pain-free, and they come off and they are in tears. And so they come in and, yeah, it's a great device. It was actually created for the astronauts to train them. But yeah, there's all kinds of resources out there for you. I just encourage you guys to explore them. I do have one in my clinic if you'd like to come try it out. I'd do it for free for you. So come talk to me.
I actually would love to do that.
That's really
I'm gonna check that out. Look for a blog post. I'm gonna report on my complete experience. Okay, are there any herbs or Ayurvedic medicines or vitamins that have been found to be helpful in management of movement issues and comfort levels? So maybe Dina or Dr. V, you guys could talk about that.
All right. Well, I guess I get the Ayurvedic question because it's from my part of the world. But actually,
Your name on it. That's why I asked you.
No.
Okay.
But actually, I've done some research on it. A few years ago, we had done a whole series of investigations of what Ayurvedic medicine herbs can do for patients with... we had focused on diabetes, but during our research, I also noticed that there were a lot of studies on joint issues, rheumatoid arthritis in particular. So there are herbs, there are studies supporting their use, and the ones that come to mind are ashwagandha, sarsaparilla, shiitake, shatavari, and I think that's what astragalus is the other one that came to mind.
Things to reduce inflammation.
There you go.
You got the inflammation.
So I think there's a lot of promising work out there in Ayurvedic medicine in terms of herbs. But having studied Ayurvedic medicine, I also know that herbs are not prescribed randomly like they are, you just go to Whole Foods and buy a supplement. It's really based on a particular body type. So you need to have certain herbs that work for certain body types and not for others. So one must investigate it in the appropriate manner for it to be effective. And that's my thought.
So this is my favorite question. We get this question every single conference. So I'm going to throw it out there to you, although I actually know the answer now. Is it completely safe to go off all lupus meds, even Plaquenil, once I've been doing well for a while? And I appreciate this question because when you're actually doing great for a while, you feel great, you're not having a flare, you're maybe not seeing your rheumatologist regularly. I don't know, Dr. V, you want to talk about this?
Yeah, I have to. Listen, I think the answer is yes, but with certain conditions. I think your rheumatologist has to be an integral part of that decision, the person treating you. Because you may be feeling good, but maybe there's something going on in the background that you're not noticing, and your doctor can, look at it and give you appropriate information. But since we got a question about Plaquenil, I want to take a little bit of this opportunity to speak to you a little bit about our new data about Plaquenil. The American Ophthalmological Association has come out with new guidelines saying that after using Plaquenil for approximately 5 to 7 years, the incidence of eye toxicity from Plaquenil actually increases significantly. So at that mark, so the ophthalmologists say, we don't like it after 5 to 7 years. But we rheumatologists love this drug. We want to give everyone who has lupus this drug because we really think it makes a huge difference. Plus, it's one of the safer medicines that we have available to us. So my response and my feeling about this drug and how we use it is that after 5 years of usage of this medication, one must really have a serious discussion with their physician and figure out if it's actually adding anything to the mix at this point, if it's helping you in any way, or if it's redundant at that point in time. If the risk for eye toxicity is high and your eye doctor really insists that it's not good for you at this point, then other alternatives must be explored with Plaquenil.
Okay, I think this is for Dr. Snibbe. Can amniotic fluid help with avascular necrosis of the hip?
Good question. Yeah, it's a great question. The short answer is we don't know because it's so early. There's been a lot of research looking at avascular necrosis with actual bone marrow and with platelet-rich plasma, where basically the surgeon will drill. There's a concept with avascular necrosis called a core decompression, where basically you drill up kind of from the side of the hip up into the lesion, up into where the bone has died to promote blood supply. You drill up into it, and then you inject either bone marrow, a concentration of bone marrow which has stem cells in it, or platelet-rich plasma. Amniotic fluid works on the cartilage, so you wonder if you go on the other side, like if you do that procedure, then you go into the joint and inject that fluid, that would preserve the cartilage. It hasn't been done. There hasn't been a lot of research done. The problem with avascular necrosis is a lot of people, by the time that it's bad, they get to me, and it's already like destroyed their hip and they need their hip replaced. So the issue with avascular necrosis is getting to it early and getting it to the early stages, and that's where, like in my career, I've only saved about, I think probably maybe 2 or 3 hips that have got to me early enough where I've been able to drill up into the lesion and allow it to heal. The other thing is that if you're on medications, for example, you're on chronic steroids or certain medications and you still remain on those medications, none of those procedures will work for you because you're still creating insult to the bone. So it has a lot to do with a lot of different factors, but it's a great question, and I think that's where my discussion of kind of biologics is so exciting in our world now, because there's so many things we can use to try and help different conditions. And most of the things in medicine that get discovered are things that we don't even think about, meaning that they think this drug's going to cure this and ends up curing something else. So we really have to explore all the different opportunities, and that's what's really exciting to be alive right now.
Okay, how or why does high energy expenditure and or overexercising cause and or contribute to a flare-up?
I think that you have to recognize the fact that your autoimmune system is already compromised and your system doesn't quite function and regulate itself like someone without lupus. That's why I really recommend, if you have the opportunity, to get a heart rate monitor or a Fitbit to monitor yourself. That way you will have control of this. Okay.
I'd like to add a little bit to that. So I think part of the question was how and why. And so from what we understand of lupus, the immune system is overactive. We know that. But for the immune system to be overactive, it needs to get energy, okay? So it needs to get energy from somewhere. And it's coming from the food that you eat, and it's taking away your energy resources. Now, in a system with depleted energy, if you overwork that system, what's going to be the result? You're going to deplete it, you're going to run it dry. I think that's kind of the biological basis for what's going on in lupus and fatigue, and how you can actually push the system, which is your body, beyond its normal capacity, just because the immune system is so overactive on the background and using up all this energy. Hopefully that helps.
Okay. I think maybe for all of you, is chiropractic care good for joints for people with lupus, good or bad?
I actually
Is chiropractic care good or bad for people with lupus?
I was actually talking to Dina earlier, and again, I want to emphasize that all of us work as a team for you, and I don't think that any one discipline is better than the other. I think that you have to figure out what works for you. Is it doing Pilates? Is it doing yoga? Is it physical therapy? Is it a chiropractor? Is it, you know what I mean? There's so many. Acupuncture, another great discipline to use. I think that if you have a true professional that can assess you appropriately, I think there may be cases where it is okay. It just depends, again, on you and what the chiropractor is treating. Did you want to add anything? Did you? No?
I think with chiropractic, like any of the other disciplines, can be helpful. And in certain situations, I think by itself, I don't think one approach is going to cure a chronic, multifaceted disease like lupus or pain from it. But in certain situations, I've certainly seen it help patients. I think repeated reliance on only one technique like chiropractic or even physical therapy or even medications that we prescribe is not going to solve everyone's problems.
Actually, also, I just wanted to mention that just like I was mentioning with the types of yoga, chiropractors treat differently too. So if you can find a chiropractor that works a little more gentle, that might work for you.
Thanks. Okay, does bone mass play a role in joint pain? If so, what activities are best for maintaining bone mass?
Thank you.
Let's go, yeah.
I mean, I think we all know that stress, there's a concept in bone called Wolff's Law. And basically, when you put stress on bone gets stressed, it remodels and reinforces itself. If you, for example, when you go into space and there's no gravity and there's no stress on your bones, the astronauts lose a lot of bone mass. And that's one of the biggest issues for space travel is trying to figure that out. And so I think the more you have some type of weight-bearing activity, whether it's yoga, whether it's just gentle walking, whether it's maybe some light weights, resistance bands and stuff like that, all of those are important for maintaining your bone health. And ultimately, joint pain is so multifactorial. Can it be because your bones are softer? It can be. It can be because your cartilage is more damaged, because you're weaker, you have limited range of motion. There's so many factors that contribute to it. But really, maintaining your bone health is important. But it's one of those things where the degree of osteoporosis you get, the degree of bone loss you get, we're learning a lot of it's genetic. And ultimately, with all the treatments that we have in this world, and Dr. Ventropoli can hit on some of those topics, is that it's not about necessarily gaining more bone. You know, it's hard to make the bone of an 80-year-old woman to like a 20-year-old, but maintain that bone, keep the bone there. And I think that's key. But I think some type of resistance, some type of weight-bearing exercise is important.
Okay, this is a question for Dina. Oh, sure, please. Sorry.
So, bone loss. So human bone, from the studies that we know, and Jason, correct me if I'm wrong, is it stops growing after the age of 30. So you reach your peak bone mass around that age. So for the young women in the audience, you have to work on getting a peak bone mass that's really high, because after that, it seems to start dwindling down. Around the time of menopause, when estrogen is taken out of the mix, there's a precipitous decline in bone loss, so in bone density. So that's the period when people are really vulnerable. Now in lupus, we add steroids often to treatment regimens, and they also make bone loss much worse. So it's really important, as Jason said, to try and reach the peak bone mass as high as possible, and try and maintain that peak bone mass. And the maintenance regimens really are weight-bearing exercise. You stress the bone gets a signal, a biological signal to hypertrophy, to mineralize more. You have enough calcium, you have enough vitamin D that will make the calcium settle into the bone and make it stronger, and maintain whatever you add to that whole to the bone mass by exercising regularly.
Okay, this one is for Dina. I love yoga, but find it very beneficial, but it can be very cost prohibitive for a person on disability. Any suggestions? So my add-on question to that is, one, are there places, yoga places that take insurance? Or do yoga therapists take insurance? And my second is, how do I find a free class? Because I know free classes exist.
So in terms of the insurance, I think we're really on the cusp of that being accepted in the medical world here. There are some physical therapists and chiropractors that have creative ways of dealing with that. I know that the people I've worked with, they have creative ways. So it depends. Not everybody's able to do that yet. But keep hopeful, because I definitely think it's going to happen soon. There's a lot of medical companies that are circling around. In fact, one of the programs here, Up with the Heart Patients, they're implementing the Dr. Dean Ornish program, and they have an actual yoga therapist working up there. So stay tuned on that.
I just wanted to add one thing, too. There's also free access. I know some of my patients, if they come in for an evaluation, I was talking about a web program that I use. We can also come up with a specific yoga, stretching, breathing program for you, and you can download it on the internet for free. So there's a lot of options out there now for lupus patients. So that's something else that you can think about.
I was going to say, too, if you look at your local yoga studios, often there's a community class, and that might only be like $5 or by donation. Or to tag on to what she said, if you could afford to have one private with somebody where they developed a personal program, you could do that at home. So,
since we have Dina here, I wanted to take the opportunity to ask a little bit more about this question. I've always wondered, I've done yoga on and off, and I find that I'm generally getting into bad habits as I'm doing the yoga. I've found that having an instructor really correct what I'm doing has been helpful. But now we're in this age where we have apps and internet resources for doing yoga, and we have videos and stuff like that. I wanted to ask you what your impression was of these and how you would, maybe intermix them because of the financial issues of, being able to see a yoga therapist one-on-one all the time. Is there a way to mix the two, and what's the best way to do it?
Okay. So actually, if you go online, Yoga International, if you check that out, you can get, I think, 3 to 5 sessions free per month, and that is organized by one of the founders of yoga therapy in the United States, Gary Krafsow. So I would be comfortable with you doing anything based on that website. Then in terms of other things that I see on the internet, I often watch a lot of these things, and I'm kind of horrified by alignment. So I'm not going to steer you that direction. I'm not going to steer you in the direction of looking at poses on the front of Yoga Journal. Because they're not good. So that's why really I was making the point to you. If you can find a yoga therapist, they've studied a lot deeper into the body systems, the muscles, joint health, all those types of things. And please, if you do decide to go to a class, don't be afraid to get the teacher over there to say, is my alignment good? Because the last thing we want is creating more bad habits and repetitive things that are actually causing more harm than help. Okay?
And I'll also add one more perspective from my personal experience. I mean, I think most people who do yoga, in my experience, are really open-minded about helping you. I think discussing with them what your condition might be, what specific limitations you have, and they always have some sort of modification. If you tell them that your elbow is bad and you can't do the downward dog or whatever everyone else is doing in the class, you just spend some time with the teacher one-on-one. After the class, they usually will give you a modification. So I would try and incorporate that.
And I did offer to, if you're coming to the support groups, we might be able to work something out with Toby. I know a lot of fabulous people that just want to make people feel good, so give us information. We just don't want to have teachers at sessions and nobody shows up. That wouldn't be good.
We are going to try to actually this year get a few more guest speakers at our support groups this year, so you should look forward to that. And make sure you check out Catherine's emails about support groups and what's going on at them. So look out for that. Okay, this is a question for Karen. Can you give 2 or 3 examples of what a posture drill is?
I sure can. So I told you the first thing that we start with, and I try to almost do it with all my patients, is a diaphragmatic breathing, just so you can relax. Because it's hard to take someone who's in pain and start exercising. That's why I was trying to emphasize the importance of that. Postural drills. If you think about it, sitting is the death of our spine. You get up, you sit, and you go to breakfast. You get in your car and you sit, and you maybe go to work and you sit, and then you go to lunch and you sit. It's constantly sitting. And so just a basic exercise is, I explain it like taking your shoulder blades. We used to say, put them into your coat, your pants pocket, but it's not even that anymore. It's almost like taking your shoulder blades and kind of putting them up on a hook. And just that little bit, if you just do that a couple times every hour and check yourself, it opens up your pecs, it opens up pressure in your diaphragm. We also know that lung volume can be compromised with lupus patients. So just a basic exercise of pulling those shoulder blades up and back, and you count to 3. 1, 2, 3. You do that like 5 times every hour. It will make such a difference. Start paying attention to how you sit. Because already every one of you, we're all like this. I was doing it up here until someone asked that question. So that's one of the basic exercises I like to use. The other one, depending on whether I'm evaluating the patient and they're lying down or they're standing up, is just laying down, just opening up your arms. It just stretches out all of the pecs. And again, I'm really trying to emphasize, the whole chest, lung capacity, just trying to open all of that up. And the third thing that we do is not stretch the neck, but we just move it. And that's just gentle nodding, yes and no, and sideways. And it just lubricates the joints, gets some blood flow going, and just gives you a sense of wellness versus taking a tight neck and doing that. It's not going to really respond. And that's why I like the move it or lose it comment.
So come at 1:00.
Well,
Because
The timing's a little off.
Okay.
Yes.
Come to the chair yoga, though. We're going to do posture. We're going to do nice little neck stretches. I'm going to give you just a little bit of movement in all your joints.
After lunch, we're going to do chair yoga. We're all going to do it together in mass. It's going to be great. Okay. Is cannabis oil helpful to combat joint pain? This is a newer question. We have never had this question before.
Yeah, I think it's funny the question came up because I was on a panel at one of our national meetings, and there was the topic of medical marijuana and cannabis was brought up. And, if you think about the effects of cannabis on the body, it gets rid of your nausea. You're on pain medication or this, that, you're nauseous. It gets rid of that. Gets rid of your pain. It helps you sleep. It increases your appetite. There's a lot of things that it helps. And I think that when you look at what we do, let's say I take somebody in this room and I operate on them and we say, okay, take a lot of pain medication because you're in pain. You get sick. You get constipated. You feel horrible. You take anti-inflammatories, Advil, Aleve. It can give you an ulcer. It can tear up your stomach. There's a lot of things that we give to people after an operation or before an operation for arthritis and stuff like that. That sometimes there's a lot of side effects to it, and I think that there's something to the medical marijuana field that can be very, very helpful. I just had a lady in the office. It's funny. She's like 75 years old, and her son is in the entertainment business, and he bought her these little gummy bears that have cannabis in it. And literally, for her recovery from her knee replacement, she would just take a little bite of the gummy bear and put it down. And that's all she took. She never took a pain pill, an anti-inflammatory, nothing. And so it's impressive. The treatment of it and the use of that medication is impressive. And I think 100% it's going to be legal. I think 100% we'll be prescribing it in America for care, absolutely. And then the other thing is there's been no research to ever say it hurts anybody. It's basically, natural. So I think that, I'm optimistic about it, and let me tell you, if I had to have surgery, I'd probably take it because I had a back surgery. I had a disc taken out of my back. I took one pain pill. I thought I was going to die, because I'm like naive to pain medication. So I took one, and the room was spinning. I felt so sick. I'm just real sensitive to it, and so it really opened my eyes about what patients go through. And I said, if I had to have anything done, I would try that because I think that the pain medication can be very, very detrimental. And also, as you know, it's a huge social problem in our country with addiction. And I think that, right now there's more people addicted to prescription pain medication than all the drugs combined, more than heroin, cocaine, and any other drug combined. So it's a huge national problem. And I think that we're getting to the point where if you write a prescription for a pain medication for a patient, they can't even fill it because the pharmacies aren't carrying it because there's so much abuse. So I think there's a huge part of our future, and I think I'm optimistic.
Jason, good comments. I wanted to also share what I know about it. I don't know a ton about medical marijuana, but like yourself, Jason, at the American College of Rheumatology, which is, the establishment as far as rheumatology is concerned, one of the keynote lectures was on medical marijuana. And what I remember from that talk, because I don't remember everything, okay.
Wow.
Was that there are two that basically the scientists have differentiated between the THC, which is the part of marijuana which people get high from something called cannabinoids. And the cannabinoids can actually relax muscles, and they are apparently really good for sleep. And they're very good actually for childhood seizures, apparently. And there is an increasing movement to use that type of medical marijuana for the treatment of fibromyalgia-type pain. And it seems to be a good adjunct to everything else that we're doing. Now, a comment that's, normal perception around here is, okay, this is natural, it's good. I mean, I take that with a little bit of a grain of salt because I do think that it is a psychoactive drug, marijuana, and there are problems with it. I don't think that it's all good and it's all safe. I really don't. I think there are problems like any substance that's used, any drug that's used. So I think we need to learn more. We need to see what the long-term effects of use are, and careful studies are needed. I think it's a step in the right direction that we're actually studying it and not just dismissing it. But I think we need to know more about it.
I want to say that we have so many great questions. We're going to probably do maybe 3 more index cards, but I promise that, again, we're going to get the answers to your questions and disseminate the information via email. So many, wow. Okay, I've heard about regenerative medicine. Any insights on this, and would you recommend this for a lupus patient?
You know, what I was talking about earlier about these type of biology and these type of injections and stuff like that are done is kind of part of that regenerative medicine field, where, I think that ultimately in our field, in orthopedics and dealing with joints in rheumatology, orthopedic surgery, and also there's another field called physiatry, which is doctors that take care of mostly back issues, spine issues, but also dabble in a little bit of what they call pain management, where they try to deal with all these different types of injections. There's a lot of different people that are getting involved with these aspects of medicine. And I think that regenerative medicine is kind of a broad statement, but in the field of joints, I think that's what I was talking about earlier, about using platelets, using stem cells, using amniotic fluid, using other stuff that we haven't even dreamt up, and even stuff like lubrication shots, like we didn't talk about that today, but like there's this, these lubrication shots like Synvis, Euflexa, that are used in arthritic joints to lubricate the joints, which can give you some longer term relief, 6 months, sometimes a year of relief in the arthritic joint. So there's a lot of different treatments that are part of that regenerative medicine. And then I also think that a great question was about herbs and different things. That's part of that regenerative medicine field, is that learning, kind of taking the East and the West and combining them together and saying, what are some things I can take to make me feel better? I mean, I think it's Dr. Ventrapali say the same thing about his practice. Every single week, there's a person coming in my office with some vitamin, some little pill that they're taking that they swear by. I took this and I'm better. And so it's just a lot of different things that come out. Like, I mean, one of the things that the story I tell a lot of my patients is my father-in-law had some bad arthritis in his hands, and that week a patient came in and said, I was taking turmeric and I felt better. So I told him, I said, go take some turmeric. I don't know, maybe it'll work. He's better. He's better. So that's one patient. But the point is that there's a lot of stuff that's out there, and this is going to be a huge part of the field. And at some point, I'm probably not going to ever give any injections anymore. I'll probably just be the surgeon operating on people, fixing joints when they need to be fixed. And people like Dr. Ventrapali, physiatrists, regenerative medicine people will be doing all these injections, and that will be a huge part of their field.
I'll just add my observations about this field of regenerative medicine. I think it's exciting. I think there's new stuff coming out. Basically, my understanding of it is that there's a feeling that growth factors are needed in joints that are damaged, and putting growth factors in there, whichever way, shape, or form you can get them in, is good. The problem is that nobody wants surgery. No offense, Jason, but every day I get someone like, Doc, do something. I don't want surgery. Give me the stem cells. I'm reading about this, and I think that's where this question is really coming from. It's like, okay, should I take out a mortgage on my home to pay for stem cell injections or not? And that's the problem with this. The field is promising, but the data is, not really there. We don't know if we're doing better. We don't have a study that's taken a patient, taken two patients. One of them got stem cells, the other person got placebo, and we followed them for 2 years or whatever, and found out that, the person that got the stem cells indeed did better, and he did better than the person who got the placebo and was able to avoid surgery forever. We don't have those studies, okay? So it sounds promising, it sounds great. The other problem that I see potentially, and as a physician, it's our responsibility to do no harm. And I cannot be certain that putting in growth factors taken from a patient who has an autoimmune disease, won't do more harm than good. I just can't be certain. And it's an individual decision, obviously, but it needs to be taken very seriously, and really studies need to be done to inform us as to which way to go.
Okay, I'm going to do 2 more questions, and then we're going to go on a 15-minute break. If I'm not experiencing joint pain, is cardio recommended, such as Zumba, or will cardio hurt my joints? I don't like yoga. That's actually what it says.
Again, you guys are going to get sick of me saying this. It's really individual. It depends on you. It depends on where you are with your lupus. It depends on, do you have back issues? Do you have hip issues? Do you have knee issues? There's all kinds of things to address, and that's why when you go in to see a physical therapist or yoga or a chiropractor, all of these things have to be addressed. You may have to make some modifications, like I was saying earlier. Do I want you doing Zumba for 2 hours? No, but can you maybe do it for 30 minutes with some modifications? Absolutely. If it's something that you enjoy and it makes you feel good, I say go for it.
Okay, great question. Okay, how much calcium, because we've been talking a lot about bone density, how much calcium and vitamin D should a 15-year-old girl with lupus take who also is taking prednisone? But I'm going to make this a broader question. Should people taking prednisone or other steroids be taking something? What should they be taking to make sure that their bone density and bone health stays good?
So the answer is yes. I think one of the ways that steroids causes bone loss is that it prevents the absorption of calcium through the gut. And vitamin D, one of the main biological effects of vitamin D is that it allows better absorption of calcium in the gut. In terms of calcium supplementation as a pill, until recently, we were very liberal in our recommendations for taking calcium. We would tell every patient to be on calcium supplementation, and if patients asked us how much, it was generally like more the better. But recently, within the last couple of years, there was a study that this was in postmenopausal women, so older adults. And I can't remember all the details. I have to consult my iPhone to figure out what the exact study showed. But the highlights of the study was that patients who received 1,200 milligrams of calcium in this age group, so it's an older population, not the 15-year-old, but in this older population, there was actually an increased incidence of coronary artery disease and calcium buildup in the arteries. That study has thrown a little bit of a negative light on calcium. So I think a recurring theme that you'll hear, at least from me, is that there can be too much of a good thing. So I think in moderation, it's probably good. Based on that study, I now recommend limiting calcium intake unless someone is severely osteoporotic to about 1,000 milligrams or less. And also based on the study, I recommend that calcium should be ingested from dietary sources. I have a feeling that taking supplementation may not necessarily be the best way to absorb calcium, but dietary sources where the body is ingesting the amount that it needs is helpful. But the short answer is yes, calcium and vitamin D are important for people taking steroids just because of the biological effects of steroids and calcium and vitamin D. The exact amount is controversial at this point in time, and generally my practice has been to limit it to less than 1,000 milligrams until we really understand if that one study was a mistake, or the researchers didn't do this research correctly. Can it be replicated? Do other studies show the same thing or not? So it's a question mark at this time, but again, Jason's point about weight-bearing exercise is the best way really to maintain bone mass in someone who's taking steroids. You do need to have an adequate diet with calcium and vitamin D. Vitamin D supplementation, I'll show you in my talk, which is going to come up next. It's also controversial. There's conflicting studies. In general, a few years ago, every fellow in rheumatology was applying for grants, and they would write about vitamin D. I'm going to study vitamin D in lupus. I'm going to study it in scleroderma. I'm going to study it in rheumatoid, because all the hype about vitamin D being amazing for the immune system. It can cure cancer. It can cure this. It can cure that. We're not so sure. I think there's more positive than negative with vitamin D, and I try to maintain my patients' vitamin D above 30 for sure, which is what the Institute of Medicine recommends. But in lupus patients, because of their unique predispositions, I try to shoot for closer to between 40 and 60. Because I don't know if too much more than that is needed. It hasn't been proven, and does it have any untoward consequences 10 years down the road? So based on that, I think finding the middle ground is where I go.
I just wanted to add one thing, too. I always require my lupus patients to come in with their bone density test, so we know that what we're dealing with. You know, are you osteoporotic in your spine? Are you osteoporotic in your hip? Because that's going to determine what kind of protocol we're going to set up for you. But I can't emphasize enough how important walking is. You could walk 3 times a day, like I said, for 5 minutes. Maybe that's all you need. But really, really important to have when you go in to see your healthcare practitioner, your bone density results.
We're going to take a break now for 15 minutes where everyone needs to be back in their chair at 11. But I want to thank our panelists today, Dr. Jason Snibbe, Aaron Gilbert, Dina D'Angelo, Dr. Venutra Rapali. So again, 15 minutes. There are still some snacks outside. Stretch your legs, stand up straight, and come back to sit down at 11 o'clock. These are the questions that were answered. So I don't know if you want to throw these out or...
Can I leave them up here for now?
Yeah.
So I know that I'm going to put these in.
Also, someone stole my green felted marker. It could have been me. I don't think so, though. So if you see a green felt tip... Oh, great, yeah. No, that's okay. We're taking questions all day long. Some of these questions are actually for Dr. Venutra Rapali. Hi.
Thank you.
Oh, I know. Yeah, I'm sure. I know. It is.
I was going to interject something. I don't know if you're going to have the case right now. That's
Well, they're going to get it.
Great. All right, worked out. It was fun to do it. Yeah.
I will keep you in mind.
The answer is yes. The reason is that our sediment reaching rate great. Doesn't come down. Unfortunately,
Great. So we're done. Yeah.
Thanks for grab a muffin on the way back. And walk.
Yeah, now I'm going to set up something.
All right, so come here.
I am. I'm going to do a really nice protocol that we're going to hand out information. Like what medicines to take, not to take, their responses, their exercise, how to sleep, take it on like your what happens here is that I'm like, all right, now I'm so sick.
New
oh, they're fine.
She's like, yeah, taking this.
There's a lot of people who don't.
Normal rate.
Here's all your it's
12.3. But when you're feeling good,
Exactly. I want to do that 100%.
it's going to be
I know.
And then if you need like a post-op, like like you take a patient, like like at home, like you go visit the patient, and 2 weeks, and then like 6 weeks, see that. Like I have them in my phone. I show patients in the hospital. This is somebody in 2 weeks. This is somebody in 6 weeks. This is who you are in a year.
And using this stuff like that, patients can
I know we're at our grave. Is Dr. Pepper, I'm not going to stay on.
Thank you so much.
Okay, can I come in
Yeah, I just want to go too far into all of that.
We're going to send you questions.
Yeah.
Hi. She looks like Go on up.
You guys golfing today?
I golfed yesterday.
You can't golf. It's back.
I know. That's what he said.
I got super lucky.
I'm sorry. I didn't hear.
I got my brace on. You can't see it. I took my PCL.
Oh my God.
I take care of my dad and I fractured. You need to straight line, tap to the line, acceleration. Go right on my knee, all the way on my knee. And my therapist said this is the first time she's seen a PCL. She said she's seen ACL all the time.
Much rare.
Yeah, but it's coming along pretty good. But I do have a question regarding one is they're talking about this is for you actually, and then one for you.
Yes.
They're talking about injection in my neck because I have narrow weak and I C3 and I have arthritis and I just don't sleep well. And that's part of feeling very sleepy. And so they're talking about lighter injection. Is that what?
Well, it's safe, but you got to go to somebody that knows what they're doing. Obviously, it's one of those things where they usually put a little lidocaine and a little bit of steroid.
But I'm on the treadmill for like an hour.
There's multiple areas in your neck they can put it in, like into your joints called the facets, or sometimes where the nerves live.
Okay.
To try and calm it down. There's also another type of thing they do sometimes in the neck where they burn the nerves. It's called a rhizoscopy. And so basically they put a needle into the joint, and the needle heats up and burns the tiny, not the important nerves, but the little nerves in the joint.
Yeah,
And
you
that
want
can
to
help
see.
too.
The other thing I should tell you too, do you sleep with a pillow?
Yeah, I've tried 800
Get rid of
pillows.
it.
We're not there yet.
Should I?
Get
Because I've
rid of
tried
it.
every pillow
So
on
this is
earth.
what you're going to do tonight for me.
Okay.
Lay on your back, get rid of your
Clearly
pillow.
what you're doing
Okay,
is
get rid of the pillow.
shake it.
Okay, I will do
Find
that.
something else.
You gotta figure it out. You gotta change it.
Here's your pillow. And you've tried how many and they don't
Oh, I tried everything.
That's why. Get rid
I
of your
tried
pillow.
all of them, the gel.
And
the-
you have a decent bed,
Thank
the
you.
bed will be shaking up support, you don't need a pillow.
Okay, I will get rid of them.
I'll tell you why.
Yeah, I do.
I'm sure it's my work.
Yes.
Bad neck.
Yeah, sure.
I wanted to give you one of my cards
Oh,
too.
please do.
I'm
Thank
gonna
you.
do the chair yoga after your talk,
Yes,
but
of course. Yeah, I'm sorry I can't wait for that.
Okay. I'm Ayurvedic wellness coach too, so it's kind of fun that we sat next to each other.
Push you up too hard.
I mean, I think about my kids. My kids.
Does it just come up as a, here we go.
And I have the bed now that moves.
Oh, you
Up and
do
down,
numbers
so
bed?
should I? No, actually, what part of town? Sleep number, but you just move it up. You move the top.
Is this his drive?
Should I move?
Okay.
Okay.
But yeah, push your pillow.
Can you write that therapy down that you said?
Oh, sure.
Karen, do you like it here? to show you yoga therapy.
I do. I like to do that. Yes, and I think
You want to take
it's
all
something
to
good.
yes. Why don't
And do you do
So then we can go here.
okay? Maybe inversion training to help with pain and stuff.
And we could do from here. That's not a demonstration. You think that that'll be better?
Hey,
It's usually
who's the yoga person in Walkers that you videotape?
So the flotation,
No, not Chelsea.
those chambers
Not
that
Chelsea.
use the
The other one.
Epsom
Wendy,
salt to
off
kind of
school.
make you have like
Oh, I
this.
think she teaches. I mean, a studio where I
It's
am.
not here. He can
Yeah,
do
okay,
so we
yeah.
can go through the slides here, or we do have it on your other
Problem.
so if he wants to